ACA. Patient Protective and Affordable Care Act, that's all in the news, you all read about it in the paper every day, but we're interested in how it's going to affect Connally now and in the future. This is focused specifically on Connally's future with reference to the ACA. I know some of you have become familiar with this in your own right. Mr. Rockwell, thank you for sending that survey information. That was very insightful. I do appreciate that. We'll make good use of that. Good. Maybe. Okay, Carl.
You're pushing the light.
Hmm?
You push the light.
The arrow.
Use the arrow button.
Okay.
Here.
You're on the screen.
There we go. All right. If anybody's interested, this is the formal citation for this piece of legislature, 906 pages. It was signed into effect by President Obama on February 23rd, 2010, became effective 30 days later. It is, in effect, a process of incremental implementation of programs and initiatives through 2017 expressly, but I think it's pretty well implied when you see the press and where the Congress is going with it. We're going to see this on our plates for a long time. It is, in fact, healthcare insurance reform has broad scope. Some have said this has more scope and more effect on more people and more places in government and industry than anything since FDR's New Deal back in the 30s. It's just huge. It affects insurers, providers, employers, employees, and states. We're going to talk about insurers and employers and employees. We could spend weeks talking about the effect of providers, and we're not going to go there. That's a subject for another day. First effective date, August 1st, 2012. Women's preventative services must be included. That is on newly created policies. Timing being what it is, our current policy was put into effect prior to then, but we are up for renewal, so it will be effective with our new policy. These types of initiatives are probably going to increase premiums, so we need to be prepared for that.
Guaranteed.
January 1st, 2014, dependents can be covered on their parents' insurance until the age of 26. Actually, that's already in effect. This particular provision, there are some policies that are grandfathered. They were in existence prior to the enactment of this legislation. Effective January 1st of next year, even those must allow 26-year-olds to be covered under their parents. January 1st, 2014, continued. Essential health benefits must be offered with no lifetime maximum nor annual coverage limits. It's still up in the air. What constitutes essential health benefits? That's not yet been determined. It's going to be pushed out to us probably later on this year. Again, premiums are likely to be increased because we're covering more people and more benefits than we ever have before. Guaranteed issue policies eliminates most pre-existing condition limitations. Used to keep some people out of the insurance game for a long time, and now it does not. Again, likely to increase premiums. Prohibition on charging higher premiums based on gender or pre-existing conditions. I found this interesting because what's probably going to happen is that the, quote, lower premiums will probably be increased so that there's no inequality. And that's how that's going to be handled, in my opinion, by the insurers. Okay. How does the PPACA affect individuals? Effective 2012, W-2 forms must report the cost of health insurance for the calendar year 2012. Not as taxable insurance, but as a reporting mechanism. You all know that beginning January 1, 2014, which we're going to talk about, is an individual mandate. You must have insurance, and if you do not, you'll be penalized. January 1st of this year, contributions to FSAs are capped at $2,500 a year. I only threw this in here not because we have an FSA, because general information. Might be something you all want to know about. Likewise, effective this year, tax-deductible medical expenses threshold used to be 5% of your AGA. This year it goes up to 10% of your AGA. So you're going to have less opportunity to deduct medical expenses. Beginning next year, individuals. Here's that individual mandate. Requires all individuals to have qualifying health coverage as is defined in the ACA or be subject to financial penalties. Low-income individuals are entitled to purchase insurance from the health insurance exchanges. That's a hot topic in Texas right now. If their employer does not offer coverage, they can go to an HIE even if their employer does provide them with coverage, if the coverage is not cost-effective for the individual. We'll talk a little bit more about that a little bit. Shared responsibility is a concept that establishes guidelines between the employer and the employee with reference to the provision of benefits, what they have to provide, and the sharing of the premium expenses. How does it affect employers? We're back to January 1, 2012 again. We're required to provide employees with the summary benefits coverage upon enrollment or renewal. Now, with reference to us, we did provide that for our folks for policy years beginning on or after 9/30/2012. We will have to do it again when we renew or change policies at the end of April this year. Patient-Centered Outcomes Research Institute, or PCORI fee, based upon the average number of covered lives per year for the previous plan year. $1 per covered life for policy years ending 10/1/2012 to 9/30/2013. And then it will go up incrementally every year, eventually being based upon the projected per capita amount of national health expenditures. I put this in here, it's really not a big deal unless you have a lot of employees. We'll talk about it a little bit more later as it pertains to Connally. Employers must provide employees written notice during the calendar year of the existence of a health insurance exchange to become operative 1/1/2014. This is the Texas spin on this. We all know Governor Perry continues to resist the creation of an HIE. That being the case, we're going to have a federally run HIE. And it will be available to folks here in the state of Texas. Beginning 1st of next year, that PCORI fee increases to $2 per covered life for policies ending between those two dates. Again, January 1st of next year, small employers can purchase insurance from the shop exchange. Now, since it's been enacted, small employers have been receiving a tax credit for expenditures related to going out and covering their employees. Tax credits go away, but now they have the option of buying insurance for their employees through the health insurance exchange. Waiting periods for health care benefit eligibility cannot exceed 90 days. When a new employee comes in, 90-day maximum before they can get benefits. Wellness incentive maximum reward increases from 20 to 30% cost of employee coverage. And the annual health insurer fee. This is an interesting anomaly. Federal government hasn't told us what this fee is going to be based on yet. Everybody's guessing. Nobody knows. So that directive is supposed to come out later on this year. Large employers with 50-plus FTEs subject to penalties only if at least one of its full-time employees obtains coverage through an HIE and receives a premium credit. That's the only way an employee is going to be penalized. This is kind of the boogeyman out there for employers. Am I going to be subject to penalties because I'm not giving enough coverage, not cost-effective coverage for my people? If you do not offer any health insurance at all, the penalty is the number of FTEs minus 30. 30 is kind of a deductible for you, times 1/12 of $2,000 for any applicable month. Could only be a federal formula, right? But it is what it is. If insurance is offered and the premium is credited is because the employee's contribution for self-only coverage, not employee and spouse, not employee and children, not employee and family, just the self-only coverage. This has to do with the affordability. The premium credit is because the coverage exceeds 9.5% of the employee's household income, or the plan pays less than 60% of covered expenses. If you dig into this, they've rated insurance policies kind of like gold medals and that in Olympics. They have a bronze standard, which is 60% coverage, a silver standard at 70%, a gold standard at 80%, and a platinum standard at 90%. If you do offer insurance and one of your full-time employees goes out and buys it on the exchange, your penalty is number of FTEs minus that 30 FTE deductible times 1/12 of $3,000 per applicable month. And it'll fluctuate from month to month. Okay? I just threw this in here because I thought it was interesting. Effective January 1st, 2017, large employers can have coverage through the health insurance exchange. This is a little bit of wisdom in the federal government's part. Let's phase it in for the smaller employees and develop a system, work kinks out before we start throwing the big employers into it. If the state regulations do not prohibit it, and we don't have any further information about coverage or projected cost at this time, we'll have to look at it when we get closer, see if it's even cost effective for us. Okay, now we're down to the meat of our discussion. January 1st, 2012, W-2 forms for this past tax year, calendar year, that were issued in January included a report of the value of provided benefits. We're in full compliance with that particular provision and will be henceforth in the future. August 1st, 2012, remember the mandate for women's preventative services? Only for policies that are renewing after August 1st of 2012. Our policy is in place. It'll renew effective 5/1 of 2013. I can assure you it will have the women's preventive services in there. It may well affect our premiums. The jury's still out on that. January 1st of this year, we do not currently have flexible spending accounts. I just put this in here for information purposes only. If we ever establish it in the future, we'll be subject to the $2,500 cap. Beginning next year, the individual mandate, this is a supposition on my part, but I think it's fairly solid, we are likely to see an increase in the number of participants in our health insurance so that they're avoiding that individual penalty. We will do everything in our power as an employer of choice to make sure that the insurance we provide them is cost effective. Likewise, the first of next year, this is just a rough calculation of the PCORI fee. We have 98 covered lives in our health insurance program. Our fee will be about $196. And that'll be based upon, again, if we have the same number of insured lives on our new policy that goes into effect on 5/1 of 2013. It's not a big monster, but it's something that we need to be aware of. Our personnel policies contain a 60-day waiting period, so we are well beneath the 90-day waiting period maximum that the ACA requires. And there's that health insurer fee. And again, the federal government hasn't determined it, so we don't know what our liability is likely to be on that. As it comes out, I'm sure we'll all be seeing it in the press, and we'll keep you well apprised. I thought I'd throw a few things that I think were going to affect us long term. Prohibition on insurance charging higher rates to individuals based on gender or pre-existing condition. I touched on this already. Essential health benefits with no lifetime maximum or annual limitations likely to affect premiums. Inclusion of women's preventative services with no deductible. And mandated coverage for, and this is an interesting one, approved clinical trial. That's something that got slipped in there. If somebody goes to one of the clinical trial folks up in San Antonio, have to be covered under your insurance. I'm sure the insurance carriers are keeping this in mind as well. Employer shared responsibility penalties. Not completely predictable because we don't know whether that one full-time employee might run out to the health insurance chain. We will do everything we can to keep that from happening. We do offer our employees a fully insured policy that meets the definition of minimum essential coverage by all accounts. We're pretty much in the middle of the bell curve. We're not one of those small employers that's never provided insurance. We've always had insurance because we want to be an employer of choice. We want to be able to draw really quality people here in order to be competitive, especially in the San Antonio market. We have to have that in place. We currently pay 80% of the premiums for self-only coverage. The employee's contribution is less than $1,100 a year for self-only coverage. I just did some supposition here. We don't have anybody that makes minimum wage, but if they did, that 9.5% would be $1,400. And our scale doesn't matter how much you make. If you're a self-only, you pay $90 a month for your share of the premiums for our self-only insurance. Our current and prior health insurance policies pay substantially more than the minimum 60%. Ours right now is about 80%, so we're in that gold standard. Minimal likelihood, in my opinion, that any of our employees, full-time employees, would need to obtain insurance through the HIE and receive a premium tax credit. I don't think we have much likelihood of being penalized under this shared responsibility. And then I last threw this in again. Depending upon market variables at the time, we may want to look at the propriety and cost effectiveness of purchasing it through the HIE, but we're not going to know until we see what the market variables are and what the costs are versus the benefits as we get closer to that January 1, 2017, when we can actually access it as a large employer. That's what I have for you folks. Any thoughts, questions?
Yeah, we're still in the dark.
Aren't we all?
Yeah.
We're getting it sorted out. I think slowly it's coming to us. Mr. Acker.
I just want to make a comment. I went to a seminar 2 weeks ago.
Yes,
It was put on by some high-powered attorneys and insurance brokers and the like. and you did a better job than all of them, so
Thank you,
I
sir.
appreciate it.
Thank you, sir. I appreciate that.
Your
Might have helped that I was a teacher for 4 years before I went to law school. That might have something to do with it. I thank you for your time, folks. You all have a good evening.
Thank you,
I
Dave.
do appreciate it. If you have any questions?
I got a question for you.
Yes, sir.
What does your software look like here? I mean, what I came away from that was, if you don't have a good software accounting program, the bookwork, the paperwork on this is just going to drown somebody. So does our software, does it have a good module to account for all of this?
We really don't have a good PeopleSoft or that type of a software. Many of the things that we utilize every day, I gotta be honest with you, I grassroots them. I build them out of Excel and Access, and, you know, we make do with what we can. I assume that whatever carrier we are working with at the time, be it Blue Cross or Aetna or Cigna, we can rely on them to some degree to say, okay, are we between the ditches on this? Are we okay? Are we not going to have a problem? But I do understand there's going to be some internal accounting mechanism to make sure that John Smith, who's one of our lower paid employees, is getting a good, affordable policy, and he's not running off to the HIE so that we end up with penalties.
Because the reporting is just going to go off like a whale.
It's going to be wild. I have glanced at a couple of, I get a lot of stuff come across my desk at any given day. I've glanced at a couple of the proposals for software, but we've not gotten to the point where we're ready to even start looking at features yet or implementing them.
And I don't even know if you can use this, but Sage has got a real good program that they've been developing since all this came out. But they're kind of like Congress. You know, they got to read the bill. They're having to find out how all of this is going to work, and it's just evolving.
Sure. And as we're still finalizing a lot of the regs and how they're implementing them, and those programmers are going to be programming on the fly as new things come out. They're going to have to change formulas, they're going to have to change how they track the folks, and so on and so forth. So it's dynamic. But we'll keep our ear to the ground for this for you.
Anything else? Any other questions?
Thank you, folks. You all have a good night.
Thank you, Dane. Appreciate it.
Good job, Liz.